Developing midline, belly or tummy pain following a C-section is common during the recovery period. But how can you distinguish between normal post-operative discomfort and pain that suggests serious complications? Which pain means your body is healing normally, or which suggests that you might need serious medical attention fast? Knowing this is critically important. In this video, let's examine dangerous conditions that could be suggested by abdominal pain following a cesarean section, their implications, and what might make you suspect that things are not going on as well as they should be. Hey, welcome back. I'm Dr. Sylvia, a general practitioner based in the United Kingdom, and this is AskAwayHealth. So the question is it normal to experience pain following a cesarean section? After all, it's supposed to be a pain-free birthing experience compared to having a vaginal birth. Well, taking into account individual pain thresholds, most women will experience some discomfort within the first few days, even weeks after having a normal cesarean section. For some, the pain can last several weeks or even longer. But let's talk about the nature of pain that you can expect after a normal C-section without any complications. Feeling unwell or dreading the wait for a doctor's appointment? We get it. Life doesn't stop for health concerns, and neither should you. Your GP consultation connects you to licensed healthcare professionals from the comfort of your own home. No waiting rooms, no hassle. Discuss symptoms, get advice, or manage ongoing care, all through secure video calls and chat. It's healthcare that fits your schedule. From hormonal balance to menstrual health, thyroid concerns, or menopause care, our GPs are here to listen. Get personalized, discreet care that's tailored to your needs. Whether it's a minor illness or just a question that you've got, we're here to help you stay proactive about your health. Your GP consultation, because healthcare should work for you. Visit our website to book your consultation today. You can expect to have mild to moderate pain around the site of your wound or cut. It's generally uniform pain that stretches from one part of the lower abdomen across to the other where the wound or the incision is located. Within the first 24 to 36 hours after your surgery, you may feel very little pain because you may still be under the effects of anesthesia. As the anesthetic effect begins to wear off, you'll start to experience some discomfort around your wound, which can simply be managed with painkillers. This pain may feel slightly more intense to different degrees when you move, when you cough, for example, when you lift your baby. And it's a type of pain that improves when you rest, or like I said, when you've been taking painkillers. However, another way to improve or reduce this pain is to get on your feet as soon as possible after surgery. Taking gradual, paced movements enhances blood flow to your wound, so it starts to heal quicker and reduces inflammation. Even though movement will initially make the pain feel worse, you will see the benefits of rapid wound healing over time. Normal post-operative pain will gradually improve over the next few days and weeks. The reason for the pain relates to the healing of the tissues that were cut during surgery, including nerves and muscles, knitting themselves back together as your body heals. There are other sources of pain that you might experience around the belly or in your abdomen following a C-section, and they're coming from your womb or your bladder. Cramping of the womb is a natural progression of events after you've had a baby. The womb will return to its pre-pregnant size in the days or weeks following birth, whether it's by vaginal or cesarean section birth. The pain may feel like intense painful cramps or even labor contractions at the beginning. Breastfeeding stimulates a hormone known as oxytocin, which also contracts the womb muscles and leads to painful cramps when you're nursing your baby. What about the bladder? Well, during the C-section, you would have been catheterized. This means passing a small tube into the bladder through the urethra. It helps to empty the bladder so that it's not in the way during the surgery, and it's removed sooner. However, because you've had this tube for a short period of time in the bladder, or even as a result of irritation to the bladder from having surgery, you may experience some pain or discomfort when you go to pee. This should be temporary though and resolve within hours. Now you know what to expect with normal or natural post-CS abdominal or belly pain. Let's take a look at some dangerous conditions that can also cause belly pain post-CS and how you can tell the difference. First on my list is a surgical site infection. This is an infection of the skin around the area where you received your cut, your wound, or incision. Symptoms associated with this problem include pain that is just increasing in intensity. You might notice the area looks red, it feels very warm or hot, or you might notice that the skin around the cut or your wound looks swollen. There may also be a foul-smelling discharge coming from your wound. Some people may develop a fever with a temperature of 38 degrees and above or 100.4 Fahrenheit and above. They may also experience chills or complain of feeling hot and cold. This situation requires prompt medical evaluation. You might also require admission in some cases, but you will certainly need antibiotics to treat the infection. Next is endometritis, and this means an inflammation of the inner womb lining, usually in this instance as a result of infection. Symptoms will also include a pain in the lower midsection of your abdomen. There might also be a fever with a foul-smelling discharge from the vagina, or heavy bleeding, a lot heavier than what you would expect for that particular stage of your recovery from birth. Again, this would require urgent medical attention, antibiotics, because of the very high risk of developing a condition that is life-threatening known as sepsis. The next condition that can also cause abdominal pain, but which is not normal, is known as a hematoma. Have you heard of this before? It's a collection of blood or bloody fluid within an enclosed space in the body. Hematomas can develop anywhere. In this case, you might develop a hematoma inside the womb if bleeding has not been well controlled after surgery, or it might be a hematoma within the skin tissues if there's a small blood vessel that is leaking. What you might find around the skin of the wound in that situation is swelling and some bruising around the cut, and if the bleeding persists, the hematoma continues to expand, which can lead to developing sudden severe pain. When a hematoma is causing problems like this, it might be necessary to drain the hematoma and remove the blood, especially if it's a large collection. You also need to stop whatever blood vessel that is leaking from continuing to bleed. In some cases, a hematoma can get infected, and so antibiotics as well as drainage is important for treatment. Next condition is internal bleeding. It occurs due to bleeding from the womb or pelvic vessels that were not properly secured during surgery. This condition is suggested by a tender, swollen abdomen, feeling very faint or dizzy because of low blood pressure or very fast pulse as a result of shock. It's an emergency condition that requires immediate stabilization with intravenous fluids, blood transfusion, often followed by an emergency surgery to identify and stop the bleeding. And something else that could cause you to have tummy pain in the context of a recent cesarean section is a urinary tract infection or UTI. Developing an infection of the urinary tract is something that could happen after the C-section. This is most often as a result of catheterization to the bladder. In addition to midline belly pain, pelvic or in the lower part of your abdomen, you can experience pain down below when you're passing urine, going to pass urine frequently, or an uncomfortable urge to pass urine often. Antibiotics are required for treatment in this case. The next condition that can lead to developing abnormal abdominal or belly pain after the C-section is the breakdown of the wound. Now, this is a relatively rare instance where the stitches that were applied to close your wound break down and expose the internal organs. It can happen from a poor surgical technique or if there's an infection of the wound that's not been properly treated. The symptoms there would include severe pain, and you will see the wound separating with visible tissue or organs being exposed. This is treated by emergency surgery. Next up is a condition known as bowel obstruction. It's another less common complication of surgery, but bowel obstruction can happen for a few different reasons. More commonly, we see it developing when scar tissue forms after surgery and can trap or kink the bowels or the intestines. There's another instance where you could develop bowel obstruction, and in this case, the bowel movements may be temporarily restricted by the side effect of the anesthetic or because the bowel was being handled during surgery. There is a rare effect which is as a result of direct injury to the bowel during surgery. It's not common. It's if a part of the bowel is damaged during the operation, but it can lead to symptoms of obstruction developing a lot sooner than the first two examples I've mentioned. What might you see if bowel obstruction is going on? Well, if there are adhesions or inflammation, a mechanical blockage can develop, which means that bowel content cannot pass normally. It will cause cramping, abdominal pain, bloating or swelling, vomiting, and constipation. This can be managed with surgery. In the other case of ileus, when the bowel movement is restricted, it can be treated by resting the bowel and providing intravenous fluids. Where there is persistent obstruction, it can be confirmed by an X-ray or CT scan, and surgery is performed to relieve the obstruction. It's really important to deal with this promptly so it doesn't cause permanent bowel damage. From the descriptions that we've just gone through, you will find that pain that is persistent, so it's not getting better even after taking painkillers, pain that is severe, or pain that is also accompanied by other symptoms, for example, fever, vomiting, bleeding, or feeling ill in any other way, should suggest that this is not natural or normal post-operative belly pain that happens as you are recovering from a C-section. That could be a sign to contact your doctor urgently. Check out these other videos for more tips about recovering from a C-section. Please give this video a like if you found it helpful, and use the links in the description box if you want to reach out to me or my colleagues for a face-to-face chat, and I'll see you again in the next one.